Well, this month marks 4 years since the World Health Organization first learned of the virus in China that became COVID-19. As the years pass, hindsight is 2020, and the former U.S. Surgeon General is reflecting on lessons learned during the pandemic. Dr. Jerome Adams, now a new author, joins us to talk more about looking back to prepare for the future. Dr. Adams, good morning. Thanks for joining us.
Good morning. Good to be with you, and happy December.
Happy December. Yeah, I want to ask you, take us back to 4 years. Like around this time 4 years ago, what were the conversations being had about this virus out in China?
Well, thank you for having me here. And that's a lot of why I wrote the book. I want people to remember back when we literally didn't know whether or not we should bring in our groceries, when we were wiping down our mail before we brought it in the house. And I heard you mentioning earlier about the Christmas tree lighting, when we couldn't gather together. And so we have to understand that our decision making was really influenced by a lot of things that we know more about now, but we still aren't leveraging those lessons to do better. We certainly, number one, allow political bias to impact our ability to assess health information. Number two, we need better public health infrastructure. We didn't have the data to make good decisions earlier on. And then most importantly, we need to correct longstanding health inequities. The people who died in 2020 are still dying now. They're people with obesity, with diabetes, with high blood pressure. Those are things that if we don't correct, we're going to continue to be vulnerable in the future.
Speaking of things that we could have done differently, I would imagine misinformation running rampant during that time certainly impacted, I think, everyone's decision making, not just in terms of leaders in the country. What would you say was the biggest impact that it had when it came to direction dealing with this virus?
Well, misinformation and disinformation are a public health hazard, and I talk about it in my book. I think it's very important that we understand how to recognize misinformation and disinformation, first of all. And my advice to people would be, make sure you have someone who you trust, a doctor, a nurse, a pharmacist, who you can talk to get your questions answered. Don't go to the internet, because more often than not, you're going to get bad information. We also need to make sure the CDC has the ability to actually give us good information. I was on Capitol Hill yesterday at a hearing with the CDC director, and one of the big points was that the CDC didn't have the data collection authorities and ability to be able to give us good public health information. I think those are key.
It's one thing to recognize some of the mistakes or missteps that were made in the past. It's another to ensure that it doesn't happen again. Do you think the country is in a position, were there to be another pandemic, for us to respond more appropriately?
Well, when you look at Mpox, which happened after COVID, we did somewhat better, but we still made similar mistakes in terms of delayed vaccine rollout, in terms of poor communication, in terms of stigma against certain groups and a failure to reach out to certain groups. So the answer to your question is no, we are not in a much better place to respond. And we see it happen over and over. In 2020, we had 300,000 people die under the prior administration. In 2021, completely new administration, vaccines now available, we had 360,000 people die. 60,000 more. We keep making the same mistakes. That's the overall point of my book. We need to focus on the root issues so that we can do better moving forward.
What's next for you? I'm curious. I mean, having gone through this experience once in a lifetime, right? What's next? What do you do with this?
Well, thank you for asking that question. And this book was a little bit of therapy and a little bit of PTSD for me. But what I really want to do is make sure people can be in a better position moving forward. I'm at Purdue University now, where I'm the director of health equity. And I want people to understand we need to make sure everyone has the opportunity to make healthy choices. And if we have a world where healthy communities lead to healthier choices, we're going to have better outcomes.
And then to wrap here, we're going into the winter months. There are fears of a triple-demic. What would you say is your best advice for folks who want to protect themselves?
Well, number one, read the book. I have an entire chapter on what we can personally do. But being up to date on your recommended vaccines, RSV, flu, also COVID. Know that if you're hesitant about mRNA, there's actually Novavax available, a vaccine that's not made with mRNA technology. And most of all, if you have questions, talk to your doctor, your health provider, because you trust them with everything else in your life regarding health. Trust them when it comes to COVID and vaccinations.
And we got to wrap here, but where can folks get your book?
they can get it at Amazon, Barnes & Noble, Politics and Prose here in Washington, D.C., wherever books are sold.
All right, Crisis and Chaos, now author Dr. Jerome Adams joining us this morning. Thank you so much. Happy holidays.
Thank you. Happy holidays.